Imagine you've just been diagnosed with cancer. The word alone shakes your world. And then, you hear about something called proton therapy. It's high-tech, it's precise, it promises to kill cancer without harming the healthy parts of your body. Sounds like a miracle, right? That's exactly what thousands of Americans believed. And many paid hundreds of thousands of dollars chasing that promise. Across the U.S., gleaming proton centers are rising like cathedrals of modern medicine. Each one costs more than a luxury hotel. Some even have their own marketing slogans. Gentle radiation, the future of cancer care, precision without pain. But here's the uncomfortable truth. While these centers look futuristic, the evidence behind them is complicated. For certain cancers, especially in children, proton therapy can truly be life-changing. But for many adults, the results may be no better than traditional radiation that costs half as much. So is proton therapy a medical breakthrough, or just another billion-dollar hype machine? Today, on Nourish Today, we're diving deep into the heart of America's newest medical obsession, where hope, science, and money collide. When people first hear about proton therapy, it sounds like something straight out of a sci-fi movie, using charged particles to wipe out cancer cells while leaving healthy ones untouched. It's sleek, it's high-tech, and it promises precision that feels almost magical. But in real life, things are rarely that simple. In the U.S., proton therapy has become a symbol of medical innovation, and also a source of heated debate. According to Mayo Clinic and Cleveland Clinic, proton therapy can indeed minimize radiation exposure to healthy tissues, which is especially critical for children and for tumors located near vital organs like the brain, eyes, or spinal cord. Take the case of pediatric brain cancer. In children, traditional radiation can harm developing tissues and affect memory, growth, and learning. But with proton therapy, doctors can more precisely target the tumor while sparing the rest of the brain. That's not hype. That's real science making a real difference. But when we step outside those specific cases, the story changes. Let's talk about prostate cancer, for example. One of the most common reasons people seek proton therapy in the U.S. studies from Harvard Health and Healthline show that while proton therapy may cause fewer short-term side effects like bladder irritation, it doesn't necessarily improve survival rates compared to modern photon-based radiation like IMRT. In other words, you're paying more, sometimes double, for results that might be quite similar. And cost isn't a small detail. Building a proton center can exceed $200 million. That's more than what some hospitals spend on entire departments. So naturally, hospitals need to justify those costs, which often leads to aggressive marketing. Words like cutting edge, next generation, and gentle radiation flood brochures. For patients scared and searching for hope, it's easy to believe this is the cure everyone's been waiting for. But let's bring it closer to real life. Imagine you're in your early 60s, recently diagnosed with prostate cancer. You go online and every ad tells you proton therapy is safer, cleaner, more advanced. You call your insurance company only to learn it's not covered because it's still considered experimental. Do you go with the proven treatment covered by insurance or take a financial leap of faith? That's exactly what happened to a man from Ohio featured on WebMD. He said, "When you're fighting cancer, you don't want to take chances. You want the best." He ended up selling his car to afford proton therapy, convinced it would save his life. His outcome? Great recovery. But no different than his friend who had IMRT at half the cost. His reflection was simple. Maybe I bought peace of mind, not better results. That's the emotional power of medicine mixed with marketing, and it's what makes this conversation so complicated. It's also important to remember that not every country sees proton therapy the same way the US does. Japan and the UK have adopted a more selective approach, offering proton therapy mainly to children or patients with specific tumor locations where the benefit is clear. Meanwhile, in the US, proton centers often need to attract a steady stream of patients to stay financially viable. So the lines between medical necessity and business pressure can blur. Still, It would be unfair to dismiss proton therapy as overhyped. The truth, according to Cleveland Clinic and Mayo Clinic specialists, lies in the middle. It's not about whether proton therapy is better. It's about whether it's necessary for a particular case. In the right hands, for the right patient, it can be life-changing. But as Harvard Health reminds us, precision means nothing without context, and technology keeps evolving. New compact proton systems, smaller, cheaper, more efficient, are now being developed across Europe and the US. These could bring costs down dramatically and make access fairer. It's like what happened with MRI scanners decades ago, once rare and expensive, now common and essential. So yes, the dream behind proton therapy is real, just not universal. It's not a miracle weapon against cancer, but rather a precision tool waiting for the right moment, the right patient, and the right data. When it comes to proton therapy, the science is both exciting and complicated. According to studies from Mayo Clinic and Cleveland Clinic, proton beams can precisely target tumors while sparing healthy tissue. A real breakthrough for children and for cancers near critical organs like the brain, eyes, and spine. A major study from St. Jude Children's Research Hospital showed that kids treated with proton therapy for brain tumors kept higher IQ scores and better long-term brain function compared to traditional radiation. That's not hype. That's a proven advantage. But for adults, the story shifts. Research from Harvard Medical School found that for common cancers, like prostate or lung, proton therapy didn't improve survival compared to advanced photon-based treatments like IMRT. It did cause fewer short-term side effects, but at double or even triple the cost. That cost is no joke. Each proton center costs up to $300 million to build. And in a healthcare system already stretched thin, hospitals often market proton therapy aggressively to justify the investment. Still, pioneers like Dr. Herman Soot and Dr. Jay Loeffler at Harvard laid the groundwork for this technology, believing that precision medicine could change the way we fight cancer. And in many ways, they were right. Take Abe DeLeon, a prostate cancer patient from Georgia. He proudly wore a Proton Man cape during treatment, saying it gave him hope, not just health. His story shows what data can't measure: the power of belief when facing cancer. So here's the bottom line. Proton therapy is a remarkable tool, especially for children and delicate tumors. But it's not always the better choice. The evidence is still evolving, and as research grows, we'll finally learn where the promise ends and where the hype begins. Ongoing clinical trials and research initiatives are crucial in assessing the true value of proton therapy for cancer treatment. These studies are designed to evaluate not only the safety and efficacy of proton therapy, but also its cost-effectiveness when compared to conventional treatments. Researchers are investigating a range of cancer types, including head, neck, and pediatric cancers, to determine where proton therapy may offer the greatest benefit. Platforms such as clinicaltrials.gov provide patients and clinicians with access to current studies, fostering transparency and collaboration. Early findings suggest that while proton therapy offers theoretical advantages in precision, its clinical outcomes do not always significantly surpass those of established methods like intensity-modulated radiation therapy. As research continues, the medical community hopes to clarify which patient groups will benefit most from this technology and whether its higher costs are justified by improved results. So, what's the verdict? Proton therapy isn't magic, but it isn't nonsense either. It's like buying a Tesla when a Toyota might get you to the same place. Both work. One just looks a little cooler and costs way more. For kids, and for cancers near critical organs, proton therapy can truly make a world of difference. But for many adults, the science still says, hold on, let's not confuse new with better. Maybe one day technology will catch up to the hype, and when it does, we'll be the first to celebrate. Until then, let's keep asking good questions, challenging shiny promises, and remembering that health isn't just about the newest thing, it's about the right thing. And hey, if you learned something today, or at least smiled at my Tesla analogy, hit that like button, subscribe, and join our community here on Nourish Today. where we make health science simple, smart, and sometimes just a little funny. Because honestly, in the world of medicine, laughter might be the cheapest therapy that still works.